Since 2016, when I graduated nursing school, I have noticed a huge shift in nursing career opportunities. But this has been more apparent these last 2 years. When I started off, you had your staff nurse, you had your PRN nurse, you had your per diem nurse, and the occasional travel nurse, which I never saw maybe but one time in my 5 years of staff nurse experience. Now we have staff nurses, true travel nurses, local travel nurses, internal contract travel nurses, per diem nurses, and PRN nurses. Times are changing, and so are the benefits of going with different nursing titles. Ultimately, it's the same work, but with different benefits. So today, let's talk about the differences between staff nursing and travel nursing. And when I say travel nursing, I mean all the types of travel nursing. Let's start from the very beginning of even landing a nursing job. In the travel nurse world, you can't take an assignment without having 2 years of experience normally. Every company's a little bit different and has a little bit more wiggle room, but that's generally what is out there. Turnaround time from application to hearing if you landed that role can be anywhere from a few hours to just a few days. I have personally never heard of it taking longer than that, although with internal travel nurse contracts coming out, and they are a very new thing, that process is taking a little bit longer because they have now cut out the middleman. They have now cut out that third party. Now it's going back to the companies or the hospitals to hire those internal travel nurses, and that has caused for longer wait times. Just like staff nursing roles. As a staff nurse, of course, you can come in with no experience. You can come in right out of nursing school and have just your nursing school experience and get a job. When you apply for your job, though, you could potentially be waiting for 3 months to hear back about if you landed that role or not. And that's the average, 3 months. And this is where I'm happy to talk about our sponsor today, Incredible Health. Incredible Health is helping nurses all over the country find permanent nursing roles. It is a 5-minute process to put in your information, upload your resume, and get your job matches. Unlike going on job platforms and applying to 20 different jobs a day and never hearing back, Incredible Health finds those right fit positions for you. And not only does Incredible Health help you find your next permanent nursing role, they help you understand and organize your career with multiple career guides on their website. So go check out Incredible Health at incrediblehealth.com for more information and to find your next permanent nursing role. Because who wants to wait 3 months to hear back from a staff nursing role when you can find it in 20 days or less? So we have talked about the application process. Now let's talk about the actual benefits that come with the job. In true and local travel nursing positions, there most likely is not a 401k being offered to you. Some travel companies might offer this, but if the travel company is offering this to you, that means you have to stay with that travel nurse company with all of your assignments to continue to get that benefit. Health, dental, life insurance are also offered, but it's typically at a very high rate. Now, with internal travel nurse contracts, you do receive benefits through the hospital or through the company that you're working for. Because really, you are an employee of that company, you just have a different schedule structure than a regular staff nurse. Along with benefits comes PTO time. Travel nurses typically don't get this. I received some PTO on my first contract, and I believe it was maybe 1 to 2 hours per paycheck, and I got paid weekly. It was hardly anything. Now with staff nursing, that is totally different. Again, being that every hospital deals with PTO, short-term disability, and sick leave differently. I was shocked when I took my second assignment as a travel nurse with how short the orientation process was. I had 1 day of on-the-floor orientation, and I was expected to know how to perform peritoneal dialysis on a patient the very next day. And mind you, I have absolutely no experience in peritoneal dialysis. I was taught by the educator by watching a video on how to do peritoneal dialysis, but I never actually had hands-on training on a real patient or never got to really watch it in person on a real patient, but I was expected to perform peritoneal dialysis if need be the very next day. As a new grad nurse, however, you have a much longer orientation process. Typically, depending on the specialty, 3 months to 1 year of floor orientation. And now if you are switching specialties as a seasoned nurse, as a nurse with experience, your orientation could even be 3 months long. All right, for my second to last point, I want to talk about a downfall that I saw from switching from staff nursing to travel nursing. That downfall would be the lack of company involvement that I felt that I had. As a traveler, you can't sit on committees, you can't sit on boards, or really feel like you have a say of what's going on the unit. As a staff nurse, this is totally opposite. Also, as a staff nurse, you have the opportunity, if you want, to involve yourself in the company's career involvement programs. By this, I mean going back to get your BSN and getting that paid for. Going back and getting your NP, getting that paid for, sitting for a certification, getting that paid for. As a traveler, you don't have any of those benefits. You can even go on company educational trips if you're part of the wound care team, if you are part of the disaster preparedness committee. There are multiple meetings all around the country that the hospital will send you to. It also is a way to broaden your education without you actually having to pay for it. The specific committee that I loved sitting on the most was the Disaster Preparedness Committee, and you just felt like you could really make a change in your hospital system. You felt like you could educate others about what needed to be done in so-and-so situations. I educated all the doctors, all the nurses, along with other members on the committee, how to wear PAPRs when everything first started 2 years ago. It was really neat to be able to meet other people and network with other people in the hospital, but also educate them and feeling like you're actually making a change and doing something to help others. But lastly, we cannot forget about this point, and that is pay. Of course, this is a big issue, but the gap is closing. The gap between travel nurse pay and internal travel nurse contracts is very, very close. There is hardly any gap anymore. You're also seeing this with staff nursing now. Between travel nursing and staff nursing, that gap is also closing, which is exciting to see. Travel pay is going down and staff pay is going up. There are so many other pros and cons of staff nursing versus travel nursing that I have not touched on in this video. But if you would like to point those out, please comment down below. I would love to hear from you, and I'm sure others who are watching this would also love to hear those points. Other than that, that is it for today's video, everyone. Thank you for tuning in. Thank you for our sponsor, Incredible Health, and I will see you all in the next video. Have a great week and adios.